Now, is it really possible to save thousands on medical treatment without sacrificing quality? That's what we went to Malaysia to find out. Now, as Americans, we come from one of the most complicated and expensive healthcare systems in the world. And for many of us, going to the doctor is a stressful experience, not just because of health concerns, but also because of the high out-of-pocket expenses and even the risk of insurance denying your coverage altogether. But it's not just Americans seeking medical care in Malaysia. Many nationalities are booking flights and coming to Malaysia for treatment. Indonesians in particular make up the largest group of medical tourists here. But patients from China, India, Singapore, and many other countries also choose Malaysia for affordable and high-quality healthcare. So, if you or a loved one is dealing with a medical condition where treatment is either too expensive, or you're on a long waiting list for treatment, or your treatment is not covered by your insurance, then healthcare in Malaysia might be an alternative worth exploring. So, in this video, we'll share our personal experience with Malaysia's healthcare system, from our comprehensive health screenings to visits to specialists like an endocrinologist and an ear, nose, and throat doctor. We'll also walk you through what it's like going through an inpatient surgery here in Malaysia, including the level of care you can expect. And of course, we'll break down the costs, letting you know exactly how much we paid for treatment, and even do some comparisons between the prices we paid in the US and the prices we paid in Malaysia, letting you know whether the costs are the same, cheaper, or in some cases, maybe even more expensive. All in this episode of Lucas World Travel. Well, hey World Travelers, I'm Kendra Lucas.
And I'm David Lucas of Lucas World Travel. And we spent a month in Kuala Lumpur doing health screenings and having a much needed nasal surgery. But first, let's start out with Malaysia's health screen packages.
Yes, a lot of people come to Malaysia just for the health screenings alone because these exams are quite comprehensive and gives you a lot of good insight into what's going on with you. Now, we went to the Prince Court Hospital in order to do these health screenings. Now, during these health screenings, they do things like a quick eye test, a hearing test. They do a full body scan so they can see your body fat percentage. They also do a DEXA scan so they can see your bone mass and bone density. They give you a stress test. And that was my very first stress test. That was exciting and also nerve-wracking. They do all types of blood and urine work with you so they can see all of your numbers. And they have different packages based on your age range. So David had a different package than me. With his package, it included a visit with a nutritionist as well. And at the end, you'll meet with a doctor who will give you all your results and help you interpret them so you know where you're good, what has some concerns, and both some over-the-counter things you can do to improve your health, or they'll refer you out to a specialist if you need care, if they find anything on the health screening. So I really thought that the health screenings were so thorough. I've never gone through a screening like this where I felt like they touched everything that could affect my health. Luckily for me, nothing surprising came up on the test, but naturally they still came up with some things that run in my family that I should pay attention to, which is such valuable information to know.
One of the things that I loved was just all of the tests that she's telling you about that you're going around and taking. You're not taking them all over the place. Everything is centralized. So you basically go to one building and they take you from this department to this department. And that was refreshing because they just have a simpler method. And that's very thoughtful, especially for someone coming from a different country. And they run a school of tests, like Kendra mentioned to you. So it's a lot. But at the same time, you get a lot done in a couple of days or a day of having this whole screening done. Now, it's a full day, but you just get everything under the stars. I felt like the care was just amazing. So
in terms of quality of the health screening, it was superb. So we were there from about 9 till 3:30, 9 till 4. So that's a full day. But they don't keep you waiting so long. Naturally, there's a little bit of waiting involved. So we maybe had to wait 15 to 20 minutes to do the stress test, to see the doctor. So there are some tests you do have to wait for, the radiologist and the ultrasound, but nearly everything else was almost instantaneous. It was really quick. So for David's test, he got the signature mail package, which goes to 1,800 ringgit. Now, for whatever reason, they had a discount if you paid with MasterCard, about a 10% discount. So with the 10% discount, so his screening cost $378.68. And I got the Well Woman screening package for 1,650 ringgit, which came to, with the 10% discount, $346.69. Now, for the quantity of tests that we got, I feel like that is a very good price, heavily discounted, and was very impressed by that.
We paid this cash out of pocket, no insurance, nothing like that. Their medical care here is strictly regulated, so prices for certain things cost, that's what they cost. There's no hidden fees. There's nothing sent in the mail later that we still have to pay. I had superior care than I've ever gotten in the United States.
And the facilities at Prince Court were excellent as well. They have excellent quality machinery, excellent facilities. They're not skipping on anything in that hospital. It's very nice. All right, but next we're going to be moving into seeing a specialist. Now, after the health screenings, David has had consistently high A1C and glucose numbers. So they recommended that we see an endocrinologist for that.
So naturally, when I went to the endocrinologist, I had to take blood tests again because they want to, even though they're in the same building, this particular doctor wanted to have the blood test again. He wanted to make sure that everything that the general office basically told him was consistent, and it was. My A1C was high. I was basically pre-diabetic, going into the diabetic stage. So what he wanted to do is bring me back and have me do another test. And the test was a drinking glucose type of a test and see how it went through my system after I had fasted. So he wanted to go further than any of my doctors in the States had gone. And also too, you have to understand here in this country, they are a lot more strict than our standards are in America for something like diabetes. So he wanted to make thoroughly sure before he put me on any type of diabetic medication. He wanted to see how my body was going to respond to this glucose test and different things like that. And I felt happy that he was even going further to get more specific. And so I thought that was also well worth it.
So the initial visit with the endocrinologist was $154.50. And they did blood work in the office because he wanted additional tests even outside of what was included in the health screening package. And he wanted David to come back for a second appointment where he did the glucose test. That's where they do a fasting blood draw, he drinks glucose, and then they do a blood draw afterwards to see how his body has processed the glucose. Now that second appointment with the glucose test, I was actually surprised. That test only cost $58.25. I was like, how is that less money than the initial appointment? We were very confused. But so overall, to get a diagnosis, to see a specialist, so I did take 2 appointments and about $212 to do that. But again, very good care, and he gave us all types of options on other things that he could look at because it is a hereditary thing he's dealing with, as well as a lifestyle thing for sure.
Okay, so now I'm going to talk about my nasal surgery. I have sinus problems from allergies, and I'd had this for years. It probably dogged me for at least 7, 8 years. At one point, it got so bad that I started thinking, okay, I might have to have sinus surgery. And I asked around to people who had it, And my answer came back, it doesn't really help. It's going to hurt and all this kind of stuff. So I decided not to do it. And then last year, it was really, really bad. So when I waited till we went back to the States, which is good. So now I can compare. I waited till I got back to the States, and I went to see an ear, nose, and throat therapist in the States. I asked him and asked him and asked him, what is this going to cost me? They wouldn't give me any answers. They sent me for CT scans. They sent me for imaging. I had to come back and forth for many appointments, at least 2 or 3 appointments, and they still wouldn't give me any answers as to how much the treatment would cost. They knew I needed treatment after the imaging, but they wouldn't give me a specific cost of how much it would cost me out of pocket. So after all this back and forth, they told me, okay, it's going to be about $8,000. I was squeamish about $8,000, but I was like, I probably could make it work. $8,000 out of pocket, I probably could make it work. Then the last time I went back to meet with the doctor, and he took another look at my nose and all this, and they changed doctors on me and all this kind of stuff. And then the guy says to me, I think it's going to cost, after facilities and everything, anesthetics and everything, I think it's going to cost about $18,000. And I couldn't believe my ears, okay? I just couldn't believe $18,000. And then he said, well, that's give or take, it could be more. And I've had that kind of situation happen in the States before. So my estimation was going to be, this is going to cost me $20,000 by the time this is done. And that's not with the rounds of medication and all that. That's just having the surgery, having the anesthetics, paying for a facility, and then who knows what it's going to cost for follow-up visits and all of that. So I talked it over with Kendra and I said, no, I don't think we should do that. I said, if it comes up again and we can get a better cost somewhere in the world or whatever, we'll consider that. But for now, no. And I don't trust these folks to give me a straightforward answer what this really is going to cost. I mean, it could be something astronomical by the time it's done.
Now, this is the thing about healthcare in the United States, where we're from. We didn't feel good about the doctors. Like, they didn't seem honest, if they made sense. Like, I felt good that they were competent. I felt good that they could do medical procedures. I did not feel good that they knew how much things cost and that they would do right by us. Does that make sense? I feel like they wouldn't have cared about costs. They wouldn't have tried to keep costs down. Whatever it cost, it would have cost. And like David said, it could have gotten up to $25,000 because that's how it is in America. They'll give you a price range of a difference of $10,000 to $20,000. So yeah, it could be $8,000. It could be $25,000. Like, it's such a big price difference that you're like, I can't budget for that. Like, that's not even an estimate anymore. And then after we did all that, decided not to have surgery, they billed us like we're paying cash out of pocket, and they send us a bill, which doesn't make sense, by the way. In the United States, every time he would go to the ear, nose, and throat doctor, it would cost $136. So he would pay that every time, and we're like, okay, fine. The last appointment, they sent us a bill afterwards for $484. And we're like, where is this money coming from?
I actually thought it was a mistake. I went to correct it. I went back up to the office to correct it because I thought it was a mistake.
And it's like, I feel like you're scamming us because we pay cash every time we come, and we don't own anything when we leave, and that should be it. How are you going to send me a bill for 3 times as much as what we pay for an appointment? It does not seem right. It does not seem ethical, and this is why we're not going to get medical care in the United States. Like, that is just craziness.
So when we came here, we said, okay, you know what? Maybe we'll get my nose fixed. And Kendra started doing some research and had heard about this place. And I was still skeptical, to be honest. But I was like, okay, we'll check it out and we'll see. Because we can always say no. right? So we got here, and this is how much it cost.
So we come for medical care in Malaysia. It's very easy. It's very straightforward. I know this sounds weird, but I found this ear, nose, and throat doctor on Google Maps because he had great reviews. And literally everyone's like, he did surgery on my nose. I can breathe now. It was very easy to work with him. So I'm like, okay, this is our guy. This is where we're going. And he's at Glen Eagles Hospital. And he doesn't even take appointments. It's just walk-in only. So we go during his office hours and get seen. And I feel good about the guy. So he keeps saying that it's going to be about 25,000 ringgit. And that's currently about $5,500. So we're like, oh my goodness, that's a great price, because even in the US, their first price was 8,000 before it was 18,000. So we're like, yes, let's do it. Sign us up, we're ready. But naturally, you have to do more than just that initial meeting with the doctor. So we had to repeat a lot of the tests. So our initial visit with the ENT doctor was $82 US. He sent us to have images done of his nasal passages. And that one was $142. That is actually a bit more expensive than what we paid in the US. I think the US image was like $118. So just know, things aren't always cheaper here. Then we had to go back after he had the images done. And then he did a scope of David's nose in the office, and that was $113. And from there, they went ahead and scheduled the surgery. We had the appointment, and he booked the surgery 5 days later. So that's pretty quick, first of all. So that's another thing. You can get into surgery very quickly in Malaysia. He wanted him to take certain medicines like antibiotics, steroids, to mitigate any problems that could present during the surgery. So we got medications too, to the tune of about, I want to say $60 altogether for the medications we needed before the surgery. When you go for any type of inpatient procedure in Malaysia, you're going to pay a deposit up front. For us, it was 20,000 ringgit. So that's about $4,400. And then you'll pay the remaining balance at the end at discharge. So when I paid the deposit for the surgery, they do tell you, okay, you're going to pay a 20,000 ringgit deposit. We expect it's going to cost 25,000 ringgit, but it could cost more and it could cost less. So they do warn you up front that it could be variable in the price, which I was like, okay, it's medical care. You can't be precisely right, can you? So, but at the end of all that, guess how much our bill wound up being? It wound up being 28,000 ringgit. So the doctor was pretty close in his estimate. So that's only a 3,000 ringgit difference, and that's about $667 difference in what he told us. And I'm actually okay with that, because let me tell you, it's much better to be, $600 off than to be $10,000 off like you are in the US. Like, I can absorb $600. I cannot absorb $10,000. That is pure insanity. So I'm very glad we came here for that. It was way more affordable. So we did that, and I feel like the care he got in the hospital was superb. The nurses were so sweet. They all spoke English. And to be honest, they kept him in the hospital. He was in the hospital for just a little bit over 24 hours. Like, that would have never happened in the US. Like, in the US, they would have had the surgery, maybe kept him a few hours afterwards, and then sent his butt home. But I felt like they did a good job of after surgery care and really kept a good eye on him, giving him the medicine he needed, make sure he wasn't in pain. And I want to say you weren't in pain at all after surgery. I was like impressed by it.
Yeah, they took very good care of me in the hospital. I didn't have any issues in my recovery room at all. And we don't dismiss the fact that there are professionals all over the world who can help you, and they can help you for much less. So I just look at that and I say, wow, I understand why people come. Remember I said I was skeptical at first, but now I understand why people would spend their money on a plane ticket to come here and have their serious surgeries here, where they can pay out of pocket, afford it, and not feel like they got ripped off or have to spend all their life savings because they had a medical condition, or go bankrupt because they had a medical condition.
And after the surgery, David followed up with the doctor 2 times. The first one is after they remove any type of nasal polyps or nasal things, they put a gel in your nose to stop the bleeding because, there's a lot of blood vessels in the nose. So he had to go in the first time, just a few days after surgery, for him to remove the gel. And then he came in 2 weeks later for him to just check the work to make sure everything was healing all right. And now he has like 6 months worth of nasal spray to do in order to maintain the results and all of that. So those last 2 follow-up appointments were 113 and 117 because he had to use the scope each time. They do charge you for the procedures that they do that day. So for example, the first time he went, he didn't get his nose scoped, so it was a bit less. And the follow-up times he went, he always had his nose scoped, so it was always around $113 US. Another thing is when you go see these specialists, you will not know how much it's going to cost exactly. They can give you a range of like the procedures they do in office and how much you can expect to pay. The cheapest we paid to see a specialist is $58, but on average it's going to be in the $90 to $120 range to see a specialist.
I think that what I observed was because their medical healthcare thing here is regulated, that there are specific prices for each thing. So that's why he could give a very credible estimate, because he's done this so many times before, so he could say, well, typically it's going to be around this amount. Now it might be more, it might be less, but it's going to be really close. And he gave us close. He gave us within $600 of what we thought it was going to be. But it didn't turn out to be a nightmare. This really opened my eyes to other opportunity. So this was a really great benefit to us that we came when we did and did the things that we did. So I'm very pleased with it.
And another thing I liked about our ENT doctor, which I wasn't expecting, is that he gave us his WhatsApp number. So we had direct access to the doctor. And he would like message us and be like, how's David doing? And I'm like, this doctor is like literally text messaging me. Like this has never happened in the history of my life. Yeah. I felt super confident both in his skills and his care. Like he actually cared about David. And yeah, he was just a pleasure, really. So do we recommend healthcare in Malaysia?
Absolutely.
Yes, highly. A+ score, 100%, well done. Now for us, we got care both at Prince Court Medical Center and Glen Eagles, and both hospitals were excellent. We can't speak for other hospitals. I imagine that they're great as well, but we can give those private hospitals our highest recommendation. Malaysia also has a public hospital, a public healthcare system. I do believe that's just for Malaysians, but I do think like Malaysians only have to pay maybe 1 ringgit to get care here. So
almost free.
Almost free. Like 1 ringgit might be 20 cents. So it's literally free, and we're very jealous of that. But even Malaysians, a lot of times they'll go to a private hospital because the public system can have a long wait list. So they might have to wait long for treatment or procedures. So sometimes they'll go private as well. It's good to know the citizens here do have a free option or a low-cost option as well. But I don't think foreigners can use the public system, so you will have to go private. There's already so many proven methods to have universal health care in Canada, the UK, France. They all have models that work very well, and their life expectancy is so much higher than ours. And it's just such a shame that, we're paying a lot of money to die earlier, and it doesn't have to be that way. Not that I want to end on a sad note like that. But if you're in one of those predicaments, kind of like we were, where the treatment you need is not covered, you have to wait too long for it, or it's just too darn expensive, then consider Malaysia. Because seriously, plane tickets and even a monthly Airbnb rental, if you add that into the hospital charge and how much they were going to charge us back in the US, it's still a lot cheaper.
A lot.
And you get a little vacation where you can see a new country, experience new things. So it's just win, 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 win. But no matter what country you're from, we can highly recommend medical tourism in Malaysia. It's a lovely country. It's a great place to stay for a month, by the way, if you do need to have serious treatment. And get the treatment you need at an affordable price. But if you'd like to know even more about what it's like to travel full-time and get travel tips from all around the world, please do subscribe to the channel for even more great informative videos like this. Up next, we're going to have travel guides related to Guadeloupe and Japan, so stay tuned for that. Until next time, check out our year-end review of 2024 on the right there, where we review all the countries we went to after 1 year of slow travel. As always though, guys, thanks so much for watching. Thanks for sharing with anybody who needs some medical care. And happy travel planning until next time. Bye.
Bye.